Okay, good morning, doctors. Good afternoon, depending on where you are in the country. Welcome to today's program with Spinal Kinetics, called Don't Lose Another Frustrated Chronic Pain Patient and Sacrifice Your Positive Reviews. What I'm going to be talking about today is I'm going to kind of round into a long-about way the importance of online patient reviews and just what drives that. Today, the graphic that I have up here is how often patients use review sites, and it's becoming often, very, very often. So review sites are going to be a key way to develop business for you both in the injury and in the chronic pain market injury. Remember, what causes acute pain causes chronic pain. So let's go. Most patients use online reviews now to find new providers. That's what you have to understand. This is going to be really prevalent in the injury market very shortly, as I'll tell you, and it's one of the things that should be driving you to be thinking with these things. But patients use now online reviews as the first step to finding providers. They're also highly willing to go out of network if the reviewed provider has high reviews. So, one of the things that you actually want to do is reviews are very, very important. Now, here's one of the things that's interesting, and this is the main thing that I'm going to talk about today with patient reviews, is that 9 out of 10 patients who go with chronic pain to any doctor, primary care physician, chiropractor, subspecialist, 9 out of 10 of them never know the primary cause of their pain. So diagnosis is an issue in the United States. It's very much an issue. It's very much an issue in my profession of chiropractic because there's no standards. There's no standards, and there needs to be. That's what Spinal Kinetics has been assisting the profession of chiropractic to do in the injury market. So what I want to do first of all today is I want to talk just a little bit about the fact that right now, when we talk about Spinal Kinetics, I want you to understand what Spinal Kinetics is. First of all, Spinal Kinetics is a testing company. It's a medical testing company. It's a national company that does ligament testing. We use a proprietary procedure trademarked to Spinal Kinetics called CRMA. Now, the reason why I say that is because we are going to start to, as a company, start policing. This has been abused and used by others. It is our trademark for our trademark procedure. So you can't get a CRMA without Spinal Kinetics. You can't Google without Google. You can't get a CRMA without Spinal Kinetics. So you'll start to see Spinal Kinetics starting to police its trademarked technology in the market. So there are computer softwares today that are saying that their doctors are doing CRMAs. We will start to police that. Right now, one of the things with the CRMA, and it's really important to understand for any specialist, is that the findings in a CRMA are so important that they should be done independent of the treating provider. This is true for chiropractors in treatment of injuries, spinal injuries. This is true of pain management specialists who are going to do injections. This is true of orthopedic surgeons who are actually going to do orthopedic surgery and base it on the findings of flexion extension film. It's true for sports injury doctors. Let's see, let's go to sports injury doctors, sports injury specialists that are going to restrict their patients from active contact sports because of the instability findings found in stress radiology. So stress radiology is becoming really important today, and really important today in the injury market. Now, when a provider understands stress radiology and they understand ligaments and ligament injuries, they understand the extreme need for Spinal Kinetics. Now, Spinal Kinetics is a testing company. My name is Dr. Kronk. I'm the Director of Education for that testing company. I've developed a smart injury doctors program outside of Spinal Kinetics. We had to. I had to because I wanted doctors to understand the significance of these ligament injuries and be able to put them to work in their private practice. So we set up a program called Smart Injury Doctors. Now, these are doctors that are meeting the new injury needs of the 2019, 2020, and into the next decade, the needs of the injury market. because the needs of the injury market are going to be for really smart injury doctors. So any doctor can actually go out, sign up for a webinar registration, and actually find out more about this program. Now, we do that. The doctors in the Smart Injury Doctors program fully understand why a third-party unbiased ligament read is so important to their credibility and to their ability to maintain scope of practice in their particular individual professions, whether it's an MD, it's a chiropractor, it's a physical therapist. It doesn't matter if you're treating spinal injuries. These things are significant. Now, Smart Injury Help is another service that I will provide. It has nothing to do with Spinal Kinetics, but it has to do with finding smart injury doctors. So patients will be able to log into this site. It'll be a national site that's coming some point this year, where patients will be able to log into it, and they will actually be able to connect with a doctor or a lawyer with 95% accuracy as to a provider that truly could help them. So these will be, patients will come online, they'll say what injuries they have, and then our proprietary smart meter rating system will ensure that there's a match. We'll tell what the match is for the type of injuries they have for the type of doctor that's listed. And so in that program, it'll allow injury providers to start to build a reputation, and a reputation for getting great results, not necessarily getting their bills paid. That's individual. It's great that doctors get their bills paid. It's great that they understand how to really have a great relationship with insurers, which is, by the way, what the Smart Injury Doctors program is about. Stop fighting. You don't have to fight, and you start to build a great reputation. So I just wanted to say that because these are all in some way interrelated. A smart doctor has to have great diagnostics, and a smart doctor needs to be able to be reviewed and have ability for the public to understand what makes them smart, what makes them unique, why patients should go to them. And these doctors in turn, in order to maintain credibility, have to be able to have great medical service providers. I mean, you want great medical service providers for MRI findings. You want great medical service providers for excessive motion findings. You want great medical service providers for fracture findings. The doctors that are doing treatment should stay in their lane, which is treatment. Now, let's go to, so what I want to talk about next is I'm going to use a slide presentation now to kind of explain why diagnosis is the key to getting great patient reviews, right? What I just said, and I'm going to present this very much again, what I just said is no matter where a patient goes, 9 out of 10 of them never know the primary cause of their problem. So if you can actually show them the primary cause of their problem, you're way ahead of the game in reviews. Now I'm going to illustrate an example. I'm going to show you a program that is developed for smart injury doctors. It has zero to do with Spinal Kinetics, but you'll see it has everything to do with Spinal Kinetics in just a second. It has to do with teaching doctors, in this case, how to go out and educate physician assistants on why they should use their clinic. And what is their clinic able to do? I'll show you in a second. So Ohio Pain and Rehabilitation is a multidisciplinary clinic in Ohio. This is a program built for them to actually show why physicians assistants or medical providers or anyone else in that, for that matter, should be referring to them. So let me walk you through this program. First of all, they're going to start out and they're going to say, look, we're doctors that are dedicated to changing the US market into a results-based market. We're part of a group of doctors called Smart Injury Doctors. We do 3 things incredibly well. We accurately diagnose the injuries that the patient has. We actually treat these injuries to a great results, minimizing the long-term residual complaints. We do this highly effectively and very, very cost efficiently. We also document everything that all parties need in order to allow the patient access to any benefits they're entitled to. And doctors doing these things, being able to do these things is very easy today in the market. Now, what makes us unique and what I want to bring to your attention is you have patients that are treating either with work comp injuries or auto injuries. I'm going to give you an example right here of auto injuries. When a person has an auto injury, 50% of them never fully recover. So 50% of them, no matter what procedures they do, are never going to fully recover. Now, that is not a patient problem. That's a doctor problem. Doctors have to understand the underlying condition that the patient has. Not only are 50% of these patients going to experience problems that they'll never fully recover, 30% of them will remain moderately to severely disabled by their condition. Now, this is really important to understand because patients that have these types of injuries have got to get to doctors like our doctors at Ohio Pain and Rehabilitation. And they have to be able to get there quickly, which I'm going to present. Ligament injuries to the spine are the #1 physical cause of pain and disability in the market, which is a lumbar injury. They're the 4th leading cause of chronic pain and disability, which is a cervical injury. And then the #6 leading cause of pain and disability, which is a cervical injury that yields headaches. This is really important. If we go to Medscape, these are the symptoms of a spinal ligament injury. Now, one of the things in the market that's very much so missing is most doctors don't have any understanding and are not routinely looking for the most common cause of these most common symptoms. So we look low back pain, facial pain, shoulder pain, neck pain, mid back pain, lower back pain, pain going down the legs, pain going down the arms, ear pain, ringing in the ears, disturbances in memory. Now, when we get a cranial cervical junction or a ligament damage to the base of the neck, we can have things like post-concussive syndrome symptoms showing up. Things like dizziness, disturbances in concentration, blurred vision, double vision, difficulty swallowing. Now, these are not anyone's opinion. Anyone can search and look these symptoms up on Medscape are associated with a ligament injury. Now, speed of accurate assessment of these spinal ligament injuries is absolutely the key. And the application of appropriate care is critical to reducing the long-term risk of chronic pain that never completely goes away. These patients have got to get to doctors right away. As a matter of fact, current research tells us that the lowest levels of injury, disability, and costs are when the injury patient gets to the proper care within the first 3 days, and they go up from there exponentially. That's why it's so important to get a patient to a doctor that understands exactly what to do diagnosis-wise and exactly what to do with what he or she has diagnosed. It's critical in the ligament injury market. Too few doctors today understand these injuries, which is why we provide the solutions to the biggest problems with spinal ligament injury patients have, regardless of where they're injured, whether it's a car accident, work accident, sports accident, home accident. At Ohio Pain, and remember doctors, I'm using this as an explanation for why they should refer into a specific clinic. So at Ohio Pain Management, this is our primary focus. Now let me show you the problem with diagnosis. Let me show you the problem. In the market, there's a severe problem with medical doctors, chiropractors, physical therapists, anybody that's treating spinal injuries. There's a severe problem with misdiagnosis or inadequate diagnosis. Let me show you 2 examples of it. This is a top researcher from Spine Research Institute. His name is William Morris. He's the top researcher in the world for intersegmental motion pressures. And I'm going to use the American Academy of Family Physicians because they're the senior academy for family physicians in the United States. I'm going to use just one example. I could present you with hundreds of examples of what I'm showing you. These are non-specific low back pain return to work guidelines that are published in this journal, published in 2007. Now, this is what it says. It says epidemiology. According to the U.S. Bureau of Labor Statistics, there were 4.2 million non-fatal occupational illnesses and injuries reported by private industries in 2005. Sprains and strains accounted for approximately 42% of these injuries. The body part most often involved in these injuries was the trunk, and 63% of the injuries of the trunk involved the spine. Now, here's what I'm going to tell you that we know. We know that 63% of the injuries that involve the spine, almost 100% of those involve the ligament. Now, here's the problem with most doctors in the market. The cause of low back pain cannot be clearly identified in 90% of the patients. Some physical demands, including manual lifting, bending, twisting, and whole body vibration, are associated with an increased likelihood of low back pain, but it should be noted that the association of these job factors is not equivalent to causation. However, there's strong evidence that personal and occupational psychosocial variables play a more important role than the spinal pathology or physical demands on the job. Our doctors today in the market say they don't know what the actual underlying pathology is, but they say that psychosocial variables are probably more important than that pathology, even though we don't know what it is. That's how confused the market is. William Morris of the Spine Research Institute says, look, 85% of low back disabilities, which are caused from injuries, do not have a pathoanatomic diagnosis, and that most imaging is of minimal benefit. So we have a problem. We solve that problem. We are doctors at our facility that solve that problem. We don't ever let this occur. Now, early accurate diagnosis of these spinal ligament injuries is the solution. All injuries, and this is where I want you to pay attention, doctors, all injuries to the human body cause a derangement of a body part. We determine the severity and location of the injury by determining the severity and location of the deranged body part. The mechanism of injury is merely what supplied the force to cause the injury in the first place. So if we have a fracture that occurs in a car accident, we call it an auto injury. If we have a fracture that occurs in a sports-related injury, we call it a sports-related injury. It's the same injury. Today, you have experts out there saying that there's some sort of difference between a spinal ligament injury that occurs in an auto accident and one that occurs in a sports-related accident. Nothing could be farther from the truth. Doctors that understand these injuries understand the injuries no matter where they occur. All right, spinal injuries are no different in the fact that when the spine is injured, the injury severity shows up as a bioimaging marker. Now, what is a bioimaging marker? Well, a bioimaging marker is a biological feature that's detectable in an image. And that detectable feature of the image is relevant to the patient's diagnosis. So we just saw here a couple slides back, this is a bioimaging marker. It tells you that you have a fracture. It tells you exactly where it is, and it tells you how severe it is. So we know, let's make a review of the spine, because we know with the spine, there are 3 important bioimaging markers. The spine has more than 220 specialized ligaments that hold over 100 intricate joints together. Only 23 of those ligaments are discs. We know that. So we know that an MRI study is only studying these 23 ligaments. Our stress radiology testing that we do is testing the rest of the ligaments. When a spine is injured, it gets injured with shear and compressive force. And there's only 3 imaging derangement patterns that can be imaged: fractures, and there's 2 ligament findings. One is a herniation of a disc. That's found on MRI. The other, and it's the most important finding and the one that most often goes undiagnosed, it is the major cause of acute pain in injured patients, and it is a major cause of chronic pain in the chronic pain patient, is excessive motion. So inherent, which means inseparable, inherent in a spinal sprain is 3 things: excessive motion, or a disc herniation, or you could have both. So our doctors actually know, look, when they are dealing with an injured patient, and this could easily be converted to the chronic pain patient, they know that if they have pain in a particular area, they're starting to identify it to a level. If they have tingling, stiffness, if they have burning, if they have numbness, they're starting to locate it to a very specific level. They then do a They do testing procedures to test if they have a motor deficit or a sensory deficit. These are standard things that injury doctors do in the market. They're standard things that should be done with any chronic pain patient to identify what the chronic pain is. And any doctor that can do what I'm showing you today can do, I'm telling you, will have super high patient reviews if you position what you're doing with the patient correctly. So these patients have these problems. Now, doctors of chiropractic who are familiar with the nerves, which are not all of them, doctors of physical therapy, which are familiar with the nerves, doctors of medicine that are familiar with the nerves, know exactly where these levels are. They do stress testing. The stress testing yields excessive motion findings, and they quickly and accurately correlate for spinal instabilities in this area, and they have adjudicated exactly why they have headaches or why they have the neck pain and the arm numbness into the arm. They have the exact cause and the exact effect that's causing the symptom. And that is super powerful in the market today. Now, we're also the safest providers, right? Because when patients are injured or they have problems, you have to have doctors that understand how significant these problems can be. This is return to play parameters for cervical spine injuries, and you'll see that excessive motion is a key indicator of whether the person should be back in full contact sports or if they should be allowed to heal up first. It also is a key interest. So our doctors are actually safer. They're safer in the market. We also know that the same problems that cause the chronic pain, that cause the acute pain, the same injury findings are the same findings that are needed to pre-authorize surgical procedures. And at the lowest level, conservative care providers have got to know what these things are so that they can adequately treat them. There's not a patient that has this type of injury or has this condition that should be treating with a doctor that doesn't understand what it is in the first place, because that's how you knock it out. X-ray science from June of this year actually showed us that in medical diagnosis, test sensitivity is the ability of a test to correctly identify those with a disease, or specificity is the ability to tell if they don't have a disease. With X-ray, we know now if a patient has excessive motion in the extension views, if they're at the C5, C6 level, then there's a 93% accuracy that they have a disc herniation there. If they don't have any extensive motion there, it's 100% specific that they don't have a disc herniation there. C4 and C5, 77%, it has a disc herniation. 92%, it doesn't have a disc herniation. So this also allows us as providers to reduce down the unnecessary utilization of MRI and MRI findings, because a disc herniation that has severe excessive motion at, above, or below is one of the most serious injuries that the patient can have, whether they're in acute pain or this acute injury is now causing chronic pain. They got to have doctors that understand it. If a disc herniation has no excessive motion at, above, or below, it's a completely different disc herniation. So with our doctors, there is no more ligament injuries that go undiagnosed. And now with the proper treatment program, they can easily be established and generate great treatment results. But you got to remember, the sooner the better. Time really matters. The longer the patient is away from somebody that understands this condition and how to treat it, the higher their risk. Remember how I showed you 50% of the patients never fully recover and 30% of them actually have long-term real problems? In that current research, well, time really matters. That's why we want you to make referrals into our center, and we'd like to have them made quickly. That's why, because if you care about the patients, which we know that you do, they've got to get in the sooner the better, the quicker there is. Now, every 2 seconds in America, there's a home-related injury. Every second, there's a work-related injury. Every 7 seconds, there's an injury in an automobile accident. Injuries are the most problematic thing in the market today. They're the most common cause of chronic pain. Now, what I'm going to tell you, doctors, is that great reviews come with great patient results, no matter what you do in the market. And I'm going to tell you that great patient results come with understanding the patient's condition. And I'm going to tell you, as an injury provider for years, if you understand injury, you understand the chronic pain market, and that's what the majority of you are in. Now, there are things that you can do. It doesn't mean every chronic pain patient has to see Spinal Kinetics or anything else. There are ways that you can actually make determinations of excessive motion and do spinal instability examination procedures with or without Spinal Kinetics. Your choice on that. But as far as in the injury market goes, you want to have an unbiased third party always. So you get great patient results. It always starts with accurate diagnosis, and that's significantly enhanced with CRMA testing. Now, I just went pretty quickly, but what I wanted to show you this morning or this afternoon, depending on where you are, is I wanted to show you, one, patient reviews in the market matter. Patient reviews are coming, and it's not hard to get good patient reviews if you get good patient results. If you're not getting good patient results, understanding injuries is the absolute key to expanding your, I don't care if you're doing functional medicine. I don't care what technique you're using. I don't care what modalities you're using. Understanding the underlying condition that you're treating is key. It's key in the market, and it's key to getting great reviews. Now, what I'm going to finish with before I open it up to question and answer is, look, at Spinal Kinetics, we are trying to seriously improve the professionalism of all professionals that do intersegmental motion testing. We have zero to do with DXD software, DRMA software, posture ray software, or any of these chiropractic softwares. We are not about that at all. We are a completely different and unique service. As a matter of fact, we will be taking out, we will start to clean up the market, because some of these softwares claim to be doing CRMA procedures and whatnot. We will start to clean that up. Doctors who are not using Spinal Kinetics will not be able to say that they're doing CRMA procedures, because that's the trademark of Spinal Kinetics. And the reason why we want to do it, it's not because we're antagonistic against these, it's just that these things promote things that we would never promote. Absolutely never promote. And I'm not saying it's bad, it's just bad in the injury. Some of the things are bad in the injury market. Some of the things, for example, posture ray is a wonderful technique, X-ray procedure, X-ray software, and it's fantastic. It's fantastic, but it does not do what Spinal Kinetics does. So here's what I want to end with. I want to end with a couple of testimonials. This is Dr. Daniel Knight. This information is directly applicable information on ligament and ligament injuries. Remember, I said smart injury doctors learn about ligament injuries, and then they learn to use companies like Spinal Kinetics. This information is directly applicable to my practice and will help me to improve as a treating doctor and increase my expertise in the personal injury market. Additionally, if the techniques were universally used, the chiropractic profession would be elevated and garner greater respect in the medical field. They also would garner greater respect in the insurance field. So what I want to do now is just open it up to question and answers. Doctors, if you have any questions on anything that I went over, please go ahead and just let me know, and I'll answer any questions that you have. So, okay, this question is, how about lateral translation, especially of the upper cervical spine in a T-bone? Can we see XYZ Cartesian coordinate normals versus abnormals? No, there are no normals versus abnormals if you're talking about the axial spine. That's why we as a company don't even touch it. There are no normals in the axial spine for the XYZ Cartesian coordinates on lateral translation. So what the doctor's talking about is if you bend to the right or you bend to the left, your whole spine, instead of bending forward or bending backward, which is traditional flexion extension, some doctors will actually talk about, okay, there's rotation factors when they bend that are abnormal, therefore it shows ligament damage, but there are no normals or abnormals. So companies, medical company like Spinal Kinetics doesn't touch that until there's established numbers with it. Okay, how soon before Smart Injury Help will be online? It's That'll be a little while yet, simply because we're in a unique phase right now with it's more complicated than what was originally thought as far as the database goes and database manipulation, not manipulation, but database algorithms. Good. I didn't know CRMA was yes, CRMA is the trademark of Spinal Kinetics. It's trademark procedure. That's what we called our procedure. And again, we will be going out into the market and starting to clean that up. You can't Google without Google. You can't CRMA without Spinal Kinetics. Now, we don't care if people are doing excessive motion. We just don't want that excessive motion testing to be aligned with us. We want the market to understand when they're getting the product of a CRMA, they're getting it from Spinal Kinetics, they're getting it from a medical company, they're getting it from an unbiased doctor who's been trained in the procedures themselves. Okay, any other questions? Okay, doctors, every time we do one of these, I try to keep them short, sweet, and to the point, unless you've got questions. Hopefully you got something out of today. I appreciate your time as always. Look forward to having you on our next program. So thank you very much.